Hello, Karen. I didn't know you joined Alliance. Hello, Eleanor. Where have you been?
Okay. Hello, everybody. Thanks for coming on time. Because we are waiting for a few more guests to come, we will start in maybe 5 to 10 minutes. Yeah. Thanks for your patience, everybody.
Hi, Eleanor. How are you?
Who's that?
Huh?
What?
Can't hear you, girl. My dear.
Hello.
Too soft.
Hello.
Maybe on a I can hear 20%. Scale 1 to 10, about 2 or 3.
Yeah, whoa.
Okay, I'm changing my volume also. I don't listen to music as well. Okay.
Hi, everyone. We will start at 7:10 sharp. Thank you.
Hello and good evening, everybody. Welcome to this Social Connex. The Social Connex is jointly organized by Suristic and the National University of Singapore. We would like to thank you so much for joining us this Thursday evening as we dive deeper into tonight's topic. Before we begin, we would like to kindly make some recommendations for your Zoom settings in order for you to have the best webinar experience. Firstly, please ensure that you mute your microphone and turn off your video for the entire duration of this webinar. We will also be muting all non-presenters before the webinar begins, so we seek your understanding in this. Secondly, as we will be collating questions from the audience throughout the webinar, please feel free to enter your questions in the Zoom chat and make sure your message is directed to everyone. As for Facebook users, you may also enter your questions under the comment section and we will relay them to our moderator for the Q&A segment. If you encounter any technical problems, please direct your questions to Jeannie Suristic on the Zoom chat. Alternatively, you may also choose to exit this Zoom call and proceed to the Facebook live stream. The link is found on the screen as seen in front of you. Lastly, at the corner of your own box, you may find a small blue box with 3 white dots. Please click on it and choose the Hide Non-Video Participants option so that you can focus on the speaker's sharing. Thank you. And now without further ado, let us begin with our webinar. Firstly, we would like to introduce Suristic, a Singapore-based social enterprise that is committed to supporting individuals and organizations in their social impact work. This is done through her work, which includes impact monitoring and evaluation, social sector research, and capacity building, and corporate social responsibilities consultancy services. Besides her core focus work, Suristic also advocates for social causes in ASEAN through her Social Connex Series. She curates sharing sessions to raise awareness among the public on social issues and challenges. Leaders working on these social issues are invited to share their insights and work in the area. Through this platform, Suristic aspires to bring socially conscious individuals together to learn about social issues, sustainable development goals, as well as catalyze collective impact and transformational change for society. To date, various social causes and issues have been discussed together through these Social Connex talks. The NUS team is under the Seeds of Good program, which seeks to enable students to pursue their passions. It encourages the students to apply their skills and knowledge in real-life community projects to bring positive and meaningful impact to the community. Our team currently consists of NUS students from various countries, namely Singapore, China, and Vietnam. Now, moving on to the big topic of tonight, moving forward from COVID-19, supporting our seniors. In Singapore, the aging population has been a prevalent issue. Every 1 in 6 people are considered to be seniors. Not only do they make up a significant proportion of our population, they are also an extremely vulnerable group in Singapore. This vulnerability not only describes their physical health, but also their mental, social, and financial well-being. The low-income seniors in Singapore are especially affected. As such, this vulnerability has caused an adverse impact of the inequality faced by the low-income seniors in our society. COVID-19, as you are all familiar with, is a virus that has caused a worldwide pandemic. As a country, we have gone through a series of phases together due to this. In the beginning of April, we were called to enter a nationwide circuit breaker that forced us to remain at home, unable to interact with the outside world unless absolutely necessary. 2 months later, we entered phase 1 that saw the reopening of some schools and businesses, such as our beloved bubble tea stalls. We were also able to visit our parents and grandparents under strict limitations. The arrival of phase 2 was an exciting time for Singapore. All students are now able to return back to school physically. We can dine in instead of order in. We can meet our friends and families in groups of 5 and even invite them into our homes. We can even window shop across actual windows that were not on our devices. There have been many changes made to our current way of life. We wear masks everywhere we go. The use of safe entry to track our activity outside our homes, and so on. Yet, there have been changes that were greater and perhaps worse for others. Businesses were challenged. Many lost their jobs, and there was added pressure on our healthcare system. Now, let's take a step back from COVID-19 and talk about our seniors. Before COVID-19 struck, there have already been several issues that plagued the vulnerable seniors in Singapore. The biggest issue that we know about would be the loneliness that our seniors feel as the years go by. In the recent years, there have been spikes in seniors' suicides, and more seniors are also living alone. To understand more, we looked to a study done by Lina Lim and Kwa Ee Hyok in 2011, examining psychological well-being of seniors who lived alone. Contrary to popular belief, Lim and Kwa mentioned that living alone does not equate to loneliness, as loneliness experienced by the seniors refers to the emotional state where they do not feel fulfilled by their personal relationships or feel supported by their family, especially their children. Some have a host of illnesses that cause physical discomfort, and this may deter them from going out to meet people. Some isolate themselves away from the community, and some are disconnected. According to another study done by Wee Liang En, even if some seniors live with other people, they are sometimes complete strangers, and this leads them to feel a greater sense of insecurity and instability in their lives. Now, I will pass my time on to Charlene to continue this segment. Charlene, please.
Thank you, Joshen. As COVID-19 struck our nation, many of us were undoubtedly affected by all the various measures that were put in place. Many of our lives changed dramatically over the course of a few weeks. In light of this, we were wondering, how did you feel about your lifestyle changes in the face of COVID-19? Scan this QR code or enter the link on the screen to share with us your feelings. When you enter the website, you may choose to remain anonymous by clicking skip. We will not be able to track your responses. Thank you. If you are facing any technical difficulties, you may also mention it on the chat, and we will try our best to help you. You may now enter your responses. I'll give it maybe 2 more minutes and we can collate our responses and I'll share them with you in a bit. Thank you. Okay, I'll give it another minute. Okay, actually, I think we have almost all of our responses in. All right, so now bearing your own feelings in mind, how do you think the seniors felt about their drastic life changes? What are the greatest challenges you think the seniors were facing during circuit breaker and phase 1? You may enter your responses to generate a word cloud, and we will be asking our speakers to address the results later on. Please enter as many words as you would like to contribute to the word cloud. I will activate it now. Okay. Okay, you may proceed. You can go ahead now. Thank you. Sorry. I'll give it maybe another minute. I'll start at maybe 7:22, and then we'll discuss the results together. In the meantime, if you'd like to add more words, you can. Okay. Actually, I realized that the poll is full. So let me export the results and talk about it. Okay, the results are in, so I think we can go back. We can look at it together. Okay, so for the first question, this is the public response from all of you. The responses would be: the red face would be extremely unhappy, the orange would be relatively unhappy, yellow would be neutral, light green would be relatively happy, and the darker shade of green would be very happy. Okay, so according to the results, we have 14% of you feeling rather upset by your lifestyle changes. You have 33% for both relatively unhappy as well as neutral. You have 14% for relatively happy, and you have 5% for extremely happy. Yeah. So for the next slide, this is a collaborative cloud that we have come up with together. You can see that the biggest words are actually words that have been repeated multiple times, meaning that it's been submitted multiple times. So you see loneliness, we see support, lack of support, isolation, bored, and other. Depressed, I see companionship, frustrated, and boredom, family, isolated. Okay, so we have many thoughts about how COVID-19 could have adversely impacted our seniors. You'll hear from our speakers on what they think about this public view in a while. With the clamping down of social interactions and safety measures put in place, the vulnerable seniors in Singapore mainly face issues with these three facets. Firstly, they felt lonelier. They struggled with the ever-changing conditions of the pandemic situation in Singapore, and they were at a higher risk of mortality due to their vulnerable health. There have been anecdotes of seniors with age-related illnesses, such as dementia, who struggled to comply with safe distancing measures or with wearing their masks in public, simply because they couldn't remember to do so. As all of you have also known, some seniors in various nursing homes have also unfortunately contracted the virus because of their vulnerable health as well. Overall, the lack of social interaction or the necessity to stay at home as a result of COVID-19 safety measures have definitely taken a toll on many seniors' mental health. To make matters worse, many crucial services that the seniors have been engaging with regularly were disrupted because of the pandemic. And to this day, some of these services remain closed or face tight regulations. Needless to say, things have not returned to normal for many seniors in our society. While some volunteer or non-profit organizations have actively been trying to minimize the disruption that the seniors experience as a result of the closures in facilities and services, on their own fronts, they have to deal with limited resources as they continue their efforts to look out for their vulnerable seniors. With these challenges surfacing through the course of these few months, many initiatives by both governmental agencies and non-governmental agencies have been rolled out to curb these challenges. On the government's end, many safety measures have been put in place to keep our seniors safe. For instance, multiple agency efforts have been taken by MOH, MSF, and the Agency for Integrated Care, or AIC for short, to implement added precautionary measures in residential care homes with the provision of personal protective equipment, or PPE, for the staff members, active testing of the staff members, as well as other prevention practices. As for the non-governmental initiatives, various parties have risen up to provide our seniors with added support to minimize the disruption caused to their lives. For example, NTUC FairPrice has specifically set an hour away for the seniors and other vulnerable groups to have priority shopping hour. The Silver Generation Office has been actively reaching out to vulnerable seniors with weak family support, and befriending services have gone online as they are being done through telephone calls rather than in person. The National Silver Academy has started a series of courses to teach the seniors crucial skills to allow them to stay connected. IMDA has started a digital clinic to help seniors who are facing technical difficulties. In fact, various ordinary citizens in our society have also spent their time in starting new movements or producing more content catered specifically for the seniors in order to keep them entertained and keep them healthy. It now feels like a good time for me to introduce our speakers for today. We're very honored to have Eleanor, Jin Kiat, and Karen with us today to share the work that they have been doing over the past few months in their dedication to support our seniors in this very trying time. Allow me to introduce them and their organizations briefly, and I will leave them to tell you even more. Firstly, we have Eleanor, who is the founder and the director of a free seniors online magazine called Ageless Online, which was founded in 2009. Apart from Ageless Online, she also founded several other movements, including Face Up, Time Traveller, Ageless Kids, Makan with Seniors, and Project Care. These initiatives, I'm sure she'll tell you more about as we move into our conversations later on. Next, we have Jin Kiat, who is the Executive Director of Ojoy Care Services, which is a VWO focused on improving the quality of life for seniors in Singapore. They provide essential yet uncommon care practices that range from prevention to intervention and collaborate with various partners and providers to ensure that the seniors engaged in their services receive the best bio, psycho, and social care as they age. Lastly, we have Karen, who is the Deputy Executive Director of Lions Befrienders. Established in 1995, Lions Befrienders has had more than 25 years of experience in befriending and caring for seniors in order for them to age gracefully in the community. Leveraging on the support of some 1,500 regular volunteers, they regularly engage more than 6,000 seniors at risk via comprehensive programs and integrated elder care services. The befriending services extend island-wide and mainly cater to socially isolated seniors. Moderating our conversation today is Pauline, the Director of Seristic. She has been doing research and evaluative work for the social sector for the past 8 years. Without further ado, please join me as we warmly welcome our speakers and moderator to share with us what they think about our public perceptions of the challenges that the seniors face from the collaborative word count. Speakers and moderator, please. Thank you.
Thank you, Charlene, for introducing the speakers. We are honored today to have Eleanor, Jin Kiat, and Karen with us today to share their insight on the impact of COVID-19 on seniors in Singapore and the way forward based on the experience that they have working with seniors. Before we start, I would like to encourage the participant of this webinar to ask your questions that you have in mind in the chat box. We'll be shortlisting them and answering some of them at the end of the panel session. Now, let's start the panel. So please take 2 to 3 minutes each to share more about yourself and your work with the seniors before COVID-19 comes about. You may also want to share some thoughts on the work cloud that we've seen just now. Maybe we can start with Eleanor.
Thank you for having me, Pauline. Thank you, Seristic. Thank you, NUS. So I'm Eleanor Yap. I'm actually a freelance writer, but I founded Ageless Online, which is an e-magazine for those over 50. Before COVID happened, I was doing a project called Makan with Seniors, where it was an intergenerational meetup, where seniors and youths get together to eat. I'm still doing my website even after COVID, after circuit breaker, I'm still doing my website stuff. I'm doing a Time Traveller, which is an online museum, and I'm doing Face Up, which is another, and my other caregiving website called Project Care.
Okay, sure. And Jin Kiat, would you like to share?
Yeah, so Ojoy Care Services actually does a lot of counseling, as well as case management as a form of active intervention for seniors who need help, especially those who are depressed, and they suffer from a series of mental illness, including dementia. We also very much into the prevention space. So we run a program called Health-Oriented Aging in a CC, nearby CC. So just before COVID struck us, in fact, that was somewhere in January, February. We actually called a stop for most of this activity because there was a Lunar New Year. And effectively, we actually did not get to start because the COVID already struck Singapore. And even before circuit breaker, we already not seeing most of the senior in compliance with some of the advisory given by ministries. So it struck us very hard, especially the seniors. Yeah, thank you.
Sure. And Karen, please.
Thank you, Pauline. Thank you, Soristic and NUS, for inviting us to this conversation. So what Lion Befriender has always been doing is to do a lot of face-to-face interaction, both at center-based, meaning the senior activity centers, whereby we have 10, and then also in terms of their homes, because we have the island-wide befriending services, also with the social workers and counselors under our cluster support. That's our third program. And the fourth and the fifth program also involves a lot of physical interaction with them, namely with the home personal care, which is led by the nursing team, as well as the housekeepers. The last one would be senior group home, something like a nursing home, but operating out of rental blocks. So pre-COVID, before 23rd of Jan, what we had was regularly, the seniors will be coming down every day to the centers. Our befrienders will be going to the homes, interacting with them frequently, at least once a week. What it changed will be after what happened during COVID and the CB. So we noted that pre-CB, we were part of their lives, and basically, since most of our seniors, most of the 6,000 of them are at risk, and most are living in rental blocks without family, without friends. And therefore, Lions Befriender was one of their very few friends. So because of that, we were their lifeline. CB has changed the thing. However, afterwards I'll share. Lions Befriender has looked at COVID itself, while being a crisis, has also given us rise to different opportunities. So back to you, Pauline.
Sure. Thanks. Thanks all the speakers. I think based on what you share, I think loneliness and isolation has been part of what the seniors are facing ever since COVID-19 has happened. Can you share with us the impact and changes that COVID-19 has on the seniors that you are serving? I think you have shared some of it. Perhaps you can share more about the struggles they face, as well as any new learnings and insight that you all have during this period in terms of serving the seniors. Maybe we can start with Eleanor first.
So for me, I've jotted down some notes, so just to keep myself on track. You know, the seniors just couldn't go out. So there was a lot of issue in terms of vulnerability, isolation, loneliness, which was mentioned. Even some of them who were active with activities before the circuit breaker were now stuck at home with nothing to do. Some of them didn't even have, had issues with IT, so they didn't know how to get connected. So there was a lot of there was a digital divide, which is in particular very tough. Some didn't even have phones. They only had home phones. So all this was really quite tough for these seniors. There was mental health issues, possibly some elder abuse could be happening. And even those living with families could also be lonely. So loneliness just doesn't affect just those living alone. It's really important to remember that those living with families could also be lonely. Another area which I noticed also was that caregivers, those looking after their husbands, their whoever it is, parents, they were having real issues also. They couldn't put them in, they didn't have any respite. They were facing them, they were working at home and plus dealing with their caregiving. So that's all very, very trying for them. So there's a lot of stress going on at home.
Sure, thanks for sharing. And Jin Kiat, would you like to share?
Yeah, I would like to thank Suristic and NUS for coming out with this word cloud concept, and also thank all the participants for inputting all these words, the feelings that they had. Give us as speaker a very good feeling of actually what's happening, what do people have regarding what's the perspective of how vulnerable seniors are actually coping. But nevertheless, I have a few words which I thought was missing in there. One of them is actually helplessness. because like what was in the introduction, a lot of services provided by the VWOs will actually stop. We are told to stop, not that we want to stop. So then suddenly you used to go out or say, for example, going out for your medical appointment, all those stops. Yeah, and that is really very drastic. So helplessness is one. And some of them may not be living alone. They may be living with their family member whom actually has been a source of conflict. So imagine a circuit breaker, they are now 24/7 locked in with the source of conflict. So that is a form of helplessness as well as frustration. So frustration, I saw the word there, but the loneliness, helplessness is not really there. And I also saw the word essential, which I thought was quite crucial because a lot of things other than food, seniors, most of them do have multiple chronic illnesses. Food is one essential item, but there are many others. So the anxiety of not getting for their normal checkup and things like that, and their volunteers not coming to see them, only can connect with them via phone. It's very different from face-to-face. Bear in mind, especially seniors do have quite a lot of other physical impairment, hearing, walking. So those are the issues which actually make them much more in a very vulnerable state. So in other words, the vulnerability of senior actually increased from what we observed during the circuit breaker as well as phase one. Yeah, that's all I have to share. Thank you.
Thanks a lot for your insight, Jin Kiat, on the helplessness, and the increase in vulnerability. Maybe let's hear from Karen.
Like Jin Kiat, we also notice the worsening state of our seniors. Now, Lions Befriender look at it in the 4 dimensions. The dimension of, number 1, social aspect. The second dimension is the emotional aspect. The third dimension being the mental aspect, and the last one, physical aspect. So during circuit breaker, the immediate challenges the seniors had was social isolation, which then led to their frustration, the emotional changes, frustration, anger, sadness. How we know is because since the 10th of Feb, when we had to stop all the activities at the centers, all the 10 centers, as well as befriending site, we still continue connecting with them twice a week. So while 5 of our services were affected by COVID, 3.5 were considered essential services, means to proceed on restricted terms. Then the others, we had to stop the activities, but switched 100% to telephonic support. So during the telephonic calls, especially across the months, and more so during the circuit breaker, we can tell the change in the emotional and the mental state of a senior. We also have evidence on that. The evidence being, in terms of the CB period, we had 4 attempted suicides over 8 weeks, duration of 1 attempted suicide every 2 weeks. Prior to that, pre-COVID, we will have 1 attempted suicide every 3 to 6 months. So in terms of the escalation or the drop in mental health, it was very stark. Then of course, the physical aspect, because while most of us, well, I agree that during COVID period, and especially CB, it's very, very challenging for everyone, whether or not it's elders from rental blocks or elders in the community. However, the thing more so for seniors living on their own, and especially in rental blocks and without family, the problem comes because most of them are without family support or friends. And in their lives, they may only have 3 to 4 friends, 1 being LB, the other 3 could be their neighbors, etc. So once there is social isolation, immediately they have no other means of hanging out with people. Previously, they could go downstairs to the market nearby, sit down there and watch the world go by. Now they are cooped up in a 1-room flat. As you know, the conditions of a 1-room flat, while it's already considered very good in the sense that they're given huge subsidy and a lot of support in terms of the food and extra and the other aspects. The thing is that the condition in which they lived, while it's pretty good, by, especially since Singapore is a developed country, you must understand it's a very confined space. And prior to COVID, they have nothing else to do while staying in their flats. They actually sit down there and watch the world go by, or most of the time they come downstairs to hang around in the void decks, etc. So with COVID and CB especially, they're cut off from all this access and stuck to their rooms, one room. No, maybe some of them don't really like television or radio. That's the other thing. And on top of that, they are not, because many of them they have very limited education. Having basically means little or no education, because most of them living in the rental blocks are born in the post-war to the pre-independence period, where education is considered in a way a luxury, because putting food on the table was primary to everybody. It was a big struggle, it's a daily struggle for them to even find food on a daily basis. So with that, most of them not educated, and because they're not educated, anything to do with technology, anything to do with changes, they are very scared, they're insecure. So because of that, they are not able to respond quite well. And on top of that, they don't have much source of information. So during the period since 10th of Feb, while we do the twice weekly call with them, we give them as much information on the changes as well as advisory. This is to keep them in the loop, or else they'll be even worse off. So these are the situation we looked at. So in terms of 4 dimensions, completely agree with Eleanor as well as Jin Kiat. It has led to the total drop of their quality of life and their own development in all these 4 dimensions. Thank you.
Thank you for sharing. And from all the speakers, it's common that, you know, what you all have shared is that the seniors have been isolated for a long time, because especially Lion Befriender mentioned that you stopped some of your service since 10 February, which is like 4 months at least. And also Jin Kiat also mentioned you stopped some of your service earlier. And that many of these seniors are suddenly, you know, faced with a lack of support, except for telephone calls and things like that. So with these challenges in place, and with Singapore transiting to a post-circuit breaker, what are the changes or plans for changes in your models of intervention to respond to this, to their needs and safety in the post-circuit breaker phase? Because I guess right now we are not back to the normal physical visits that you can go to the seniors' home yet, right? Perhaps Eleanor wants to share first.
Okay, so the situation right now, we're in phase 2, and there's who knows, you know, there may be a chance we go back to phase 1. Who's to say, right?
Yeah.
So I guess for me, I started, if you don't mind me sharing about my project that I started. So I started a project during circuit breaker because I felt lonely. I was going a little crazy myself, being at home. But I could still go out. But I could just imagine how it would feel if you were a senior, where you're constantly encouraged to stay at home, and they were the most vulnerable group. So what happened was I felt really quite sympathetic, and also trying to figure out how to help them. And I think as a community, we really need to have some responsibility about it. So I started a project called Project Buddy, and I got a great collaborator, U3rd Age, Carol's in this who has come also on. They're amazing. So together she's been a great partner to us. I've been supported by Council for 3rd Age. So basically, I started this project thinking that I would just be serving like 10 people and let's be done with it, right? So let's go figure it out, help the community, and then yeah, okay, great, you know. So it ended up in over a week, we had 170 volunteers, people coming from all over in Singapore, all wanting to help. I had one person who even was in Australia wanting to help, and I was like, what's going on, man? You know, so I ended up starting this really in the help of, in terms of helping those who living alone and are vulnerable. They could use a friendly phone call by someone who really cares about them. And basically, the whole important value is to not leave anyone behind, was my whole take of this. So in other words, we would call them once a week and just chat. The conversation could last 5 minutes to 2 hours or whatever. So it's really quite amazing. So I started this during circuit breaker. It still continues now at phase 2. And we have served over 80 seniors. We're getting referrals from AIC, great help from them. So it's been really quite amazing. And some of these guys, it's really important to help. so that they know they're not alone. I think that's really, really vital, and that they can connect with someone, just a friendly voice, and we could even make sure that they're okay also. Yeah, so I think that's really cool with this project.
Sure. And are there seniors that you serve the AD, they are not served by other agencies in the past?
Okay, so some have come in from it's very interesting. So some have come in from the public. Neighbors have even referred their neighbor into our project. There's some that we do have referrals also from the public, or they've signed themselves up. Even family members have signed their fathers up. All kinds of things. I've even from those, we've even referred them back to AIC. It's interesting, we're going like full circle. AIC refers to me, then we refer them back. So I think it's a community effort. And it's really quite amazing. And I know you have a lot of people doing a lot of work in this area. I think it's really important to emphasize how important community is, and that we need to care. And that a simple project like what I just started, sitting at my desk, right, has really taken off. And I think that if we cared about the community, that's how we get through things, how we get through the pandemic, how we get through, and that really it's so important that we cannot leave people behind no matter what.
Yeah,
because
sure.
Right.
Thanks, Eleanor. Thanks for sharing your great initiative. And Jin Kiat, would you like to share as well?
Yeah, in fact, I'd like to answer the question I saw on the chat. The first one regarding how do we detect and support seniors who are not on the list itself, on our so-called beneficiary list. Actually, when I say our service stop, effectively, when I say stop, it means face-to-face. OJA actually have been providing service throughout, even through the circuit breaker. So what it means is that we go online. Not very ideal, but then we have been doing that because of quite a lot of seniors having physical impairment, like even eyesight or hearing. So we have been referring, we have been still, during the whole period, we have still get referral because we work with the polyclinic. We still have polyclinic referral coming in, even though that dropped because polyclinic also has been slowing down in terms of their referral. So that is one way. So we get referral. And also Eleanor has shared earlier regarding AIC referral and things like that. Then we also noticed similar thing which Eleanor have also cited, like we are getting referral from other sources, and then because most of these issue that they face is you need to really go down and see them face to face, and it could not be really resolved through phone call. They need real things to deliver to them. So those are the the difficulty that we had. Yeah, so I think that's about all that I want to share.
Sure. Just now, Jin Kiat, you mentioned about your activities going online. So that means that it's going like, you mean Zoom or things like that?
So we still do our counseling on Zoom. We still do counseling on phone. Like Zoom, for example, or even any platform that seniors that are comfortable with. I give a few examples. To be able to install all these various apps, sometimes the phone the senior have, even though it's a 3G phone, it may not have the ability to keep the memory space to even accept the app installation. Yeah. And make the thing even more complicated is every app installation might be different from device to device. It could be the same manufacturer, but model different. So to guide them is also another challenge. So, and we'll try our best to do with those. So at the end, it's still the good old phone rather than online. But the good old phone means a lot of things which have been moved online. Say, for example, yoga in Hokkien or even exercise. Those become more challenging. They could not access. Yeah. And like Karen has shared, quite a lot of them has been used to like with just a few of them, but they'll be like going down a coffee shop. Of course, during CB, all these stops. No one's supposed to go down. So, and they will get rather frustrated with all these things. And some of them, like what we have shared as well, they appreciate the whole situation, but to impose something on them is something which they might have difficulty trying to adjust to this new condition. And at their age, it's really very challenging. Yeah.
Yeah, thanks, Jin Kiat. Thanks. I think the digital divide is very glaring. Yeah. And Karen, would you like to share from Lions Befriender angle?
So from Lions Befrienders angle, we also definitely agree that digital divide is a big challenge. Maybe allow me to share. Pre-COVID days, when IMDA gave us free phone, not us, to the seniors free phone, the seniors, that was about 5 years ago, the seniors either resold the phone or they gave it to someone else or they kept it in the cupboard. Okay, so basically to them, technology is not needed because they can always go downstairs, and since they don't have many friends, it doesn't really matter. That's their thinking. Now, with CB, we actually launched the LB virtual befriending at the SAC on day 3, because on day 1, when we reopened on the 2nd of June, all our 9 SACs, they came back to the SAC so eager, waiting for their slots to come in. Then they came in, they were just so fixated on doing the activities. Within 15 minutes, they were done. Next question for them is, what do I do there? Do I go back home or do I hang around? But if I hang around, no one's talking to me. So for those who stayed on in the centers, they then raised their voice to fight for the attention of our other colleagues. And at our centers, most of the, in fact, we are down by 1/3 of our manpower, because 1/3 of our manpower above 60, so they cannot come into contact with the seniors. So with only 2 staff per SAC, with 5 seniors trying to get their attention and 1 meter apart, it becomes very chaotic. And on top of that, some seniors forgot, they wanted to approach their other friends because they were excited at seeing them, haven't seen them for so long. So all these things we have to put in place, the safe distancing measure. But when we conducted the LB virtual befriending at the SAC on day 3, we noticed a vast difference. We started with 2 pilots and 2 centers. We prepared the volunteers beforehand. We gave them very clear briefing. And the seniors were having good time such that they all forgot that they had to leave within 60 minutes. So they continued the activities until, because we gave repeated reminders, like when it's 45 minutes time, we tell them it's left 15 minutes, left 10, left 5, they still won't budge. So until we tell them we really have to go now, or else basically AIC will be violating the AIC's advisory for any senior to stay at our center beyond 60 minutes. So even one of our senior who didn't want to leave, he kept on coming back to his tablet twice to say goodbye to his virtual befriender. So we can tell that technology is not an issue for people, for our seniors, primarily because they really wanted the social engagement. So as long as there's someone to talk to them for 1 whole hour, or to listen to them, or to guide them in playing games, it doesn't matter. However, I have to say that for the seniors, when we did the pilot, we had even makcik, very old, 80 plus, even have aunties who can't even speak English, they only speak dialect. They were happy that there was someone to talk to them, even though maybe the person may not be able to understand 100%, but it's fine. So the thing is that we realize social engagement is most important for them. That's all they need. Technology or not, as long as someone is there to help them facilitate in the initial stage, help them learn to overcome their fear and be there when suddenly something doesn't work right. For example, they would ask us, hey, I don't see the person, where's the other person? Because the video has already shrunk to a corner. And sometimes when we play the games, the other side, the other party can see, but somehow I cannot see the face. So these are questions they start to panic. The reason, as I mentioned earlier on, they're not so familiar with technology is one thing. It's not just because they're not born in their age of digital technology. You and I are more familiar. The younger generation are literally born with it and able to do it at a young age. The seniors who are more educated, meaning the Merdeka generation, who are more educated, will have not so much of a problem learning technology. But for our seniors, because they are usually limited education, low or no education, it becomes a struggle because everything is about language, reading and writing. So without your R's, you're not possible to move into something which requires you to understand the letters. So that is their fear. Even though they are fearful, they're insecure, they will never say. They just keep quiet. They say, don't want. Sometimes because they are also driven by their own internal fears. How will people look at them? It's very embarrassing for them. So and also because it's Asian culture, they will never speak their mind. So when we had the LB virtual befriending at the SAC, that is only the beginning. And then the BBS was also with us in our pilot. Later on, they moved on to having this project, which we're very grateful for, to have 1,000 volunteers with us on this project. In addition, we have other companies coming in and other schools. So now what happened is for LB, since April, we are also in the smartphone deployment by the AIC. So we are given 250 phones out of the first batch of 800 phones to be deployed over 6 months to all the seniors who are uncontactable, meaning people who either don't have phones or don't wish to have phones. Because during CB, it was really difficult to find them. And if let's say 2 or 3 packets of food are left outside the door every day, by 10:30, we'll get a call from AIC to identify where is that senior. So imagine for the next 2 hours, we will have to hunt them down. At that point in time, AIC has not opened up the NEHR. Or rather MOH has not worked out the NEHR with AIC. So we have to go through each hospital, every nursing home where we think they might be in and call up. So that will be quite a scramble because we just want to know, is the senior dead or alive? Are they inside the house? That's our greatest fear, whether they will die in their units. So, so those are the phone deployment. In the case of LBCOS, the Community Outreach Services, we are very happy to say that we accounted for every senior alive. And that was a big relief for us. Okay. So for this part, so after the smartphone deployment is second phase, this is also something that you see IMDA working out. We are also supplying the database to them to make sure that our seniors, they have phones, will need have phones, right? But these are not smartphones. They will migrate them to the smartphones so that we can able to train them. So for these 2 smartphones deployment groups, what we need to make sure is that they are able to switch on the phone, use the phone, charge the phone, use the care line, especially for the under the care line program or AIC, and use the WhatsApp. Okay, so moving forward, we are also moving into telemedicine and teleconsultation already. We are tying up with the hospitals to use this technology so that the seniors are able to reach out to the hospitals for all this telenursing, as well as the other follow-up, the other aspects. So we will be working with almost all the regional hospitals in this area. So that's why I said, while COVID itself is a crisis, it has also given us an opportunity. Opportunity being that if we didn't have CB, the seniors are not shocked out of the system, or rather to them, technology is not important. They are able to survive for so long without it for generations, for decades. But with CB, they realize that it is necessary to open up, to embrace technology so that we can move forward with them. Otherwise, if the next CB comes, and also because the global pandemics, the gap between each global pandemic is getting shorter. So we are not sure. Firstly, like what Eleanor said, we're never sure whether we're going back to CB again for this time round. Or second one is, when is the next wave coming? The next wave is coming, and then we're all forced back to CB. At our staff level, I think this time around, we're all very exhausted. Every night we get this kind of calls, or every other night we get these calls, or calls from the police of attempted suicides, etc. It's also very taxing for our own staff. And on top of that, we have to send them out to the ground to search for them, which means that we're putting our own staff at risk as well. So if the seniors are contactable and we are able to do physical sighting of them, so that, because seniors usually will tell you everything there are 2 types of seniors, 2 spectrum. One will forever complain how bad things are. The other spectrum of seniors will always tell you everything's okay, but they don't want you to worry, and they don't want to see too much. But next moment, they may be the one collapsing on the floor. So we need the physical sighting to make sure that they are physically, mentally, emotionally okay. So that's why for us at LB, the WhatsApp component whereby they can learn to press the button for the video conferencing becomes very, very critical for us. During COVID, but pre-CB, we were still able to rely on informal structure because LB has been around for 25 years, and we have a village chief, block chief that runs the system on our off days. Basically, it's like the Saturday afternoon or on Sundays, they will run the parallel system for us. So we relied very heavily on them. But during CB, 1 or 2 of our village chiefs actually went back to stay with their extended families. So then we were cut off. Basically, on that block, we can't go in already. So those are some of the issues that we had. Yeah.
Thanks, Karen. And I guess following on this about what you all mentioned, are there any subgroups of seniors that would be challenging for you all to serve in this pandemic environment due to various reasons, such as resource constraint or lack of expertise, or lack of digital knowledge by the seniors? Are there any groups that you tend to serve in the past, but now you are unable to serve?
Maybe you can contribute a little bit to that question. I think one of the subgroup will be dementia seniors but living alone in the community. We say they are wandering around, trying to be compliant with the mask and all that. I think that's one issue, but they are not at all aware what's happening, and they might see one, they might have forgotten. So I actually share quite strongly what Karen has shared about the staff, because we put up a series of talks and as well as some reflection on our counselors. Like Karen, quite a lot of our volunteers are senior. I think it's high 70%. So similarly, we are told to stop 70 and 60 and above is not supposed to go and see people even until now at phase 2, to top of phase 1 or even circuit breaker. So we can rely on phone. So that to me is one very important subgroup. The other subgroup, of course, is like, I think in the question here about those hearing impairment. Hearing impairment is one group, and those who are not so mobile. So they have a phone, they may not have a handphone, but they have a home-based phone, they might have difficulty reaching there. And what about eyesight? So those are the series of questions. So,
so those with different needs will be hard to serve for you all.
Yeah, then of course, those existing already have some mental health issue in terms of they could be stabilized kids and all that. They are stabilized, but now with this CB coming in, a lot more pressure, and they may not be able to respond very well. Okay, so that is another subgroup. There are a lot of subgroups that, of course, the other subgroup is maybe they're physically everything is okay, but they just simply are not speaking our 4 official language. They're just in their own dialect, and connecting to them will be tough. So yeah, so those are the various subgroup. Actually, I'd like to touch on the question over here about having loss and all that. I also like to reflect on what Karen have shared. So pre-COVID, we're actually trying to do a very intensive digital program, or called digitalization program, where we equip seniors with on-body devices, in-home sensors. So we are trying to be as comprehensive as possible, because bearing in mind, quite a lot of my seniors may not be able to use a phone or speak the language. So visual, using either camera, with masks and all those, as well as hearing and motion detector. Those are things we're trying to put all together in as a package. So the CB came and disrupt, or before CB came and disrupt the whole thing. But now with this phase 2, we are going back and we are trying to put all this prepared for another peak, because I've been following and I noticed that a lot of countries have went to their second wave already. So I'm very afraid this will come, and we are trying to get these seniors be ready for in case there's another of this. And the other thing we have modified is that we are now, like what Karen have shared, actively engaging the youth and younger adults that can come forward to help us, because now senior cannot go to visit seniors, so we have to rely on younger adults. Why we haven't been working with younger adults is partly because of language, but now I think we got to see how we're going to overcome the language barrier, language between the volunteer and our recipient, the seniors, in terms of the speaking their languages. So those are things. So like what Karen has shared, the pandemic have highlighted many weaknesses. So we are hoping phase 2, we can quickly strengthen all these weaknesses, overcome them, and be ready for not even next pandemic, just in case there's a second wave. Yeah, that's all I have. Thank you.
Thanks, Jin Kiat. And Eleanor, would you like to share?
If I can add something, I think it's really important to understand not all seniors are the same. That's really, really important to stress. I mean, I've had the ones we've been serving, they're using home lines. They've had to, some don't even top up their handphones. We've had issues on that too. Even though they have handphones, so, and even if they top it up, then they end up not using it or don't know what, they turn it off. So, or it's like, they go into the room, then they got missed call, all kinds of interesting things that happen. But also you must keep in mind, whatever we do in this current time, right? As the generations go on, pass on, or whatever it is, the new generation of seniors are a lot more different. They're a lot more clear with their IT and a lot more savvier. So the current issues that we're facing is really the current, and we cannot blame them for them not being able to be digitally savvy, you know, and we just need to help them. So actually, the whole thing about language, I want to add to Jin Kiat's issue about language. This was an issue also so for us. Actually, it's so interesting because our project, I only discovered only just recently, I was starting to get Punjabi speaking seniors. And I was like, oh my goodness, like how Punjabi, I mean, is that the same as Tamil, which I'm so ignorant, and I apologize for that. So I was like, I was thinking, oh my gosh, like how am I supposed to get Punjabi speaking seniors and they can only speak Punjabi, you know? So it was really, really interesting. So it gave me an understanding that there were so many varied needs out there, and that basically I had to even now I've opened up my volunteer sheet. I included Punjabi in there, and I'm getting Punjabi volunteers. So I'm really blessed to be able to cover and help every race, because I think that's a real important thing. So yeah, I don't have a big issue on I had a small issue about the language thing, but really it's really important to understand that this current generation, they really need a lot of help in this digital divide. So for us, what we're planning on doing is we're trying to look at some Zoom stuff, and even some of our volunteers are using WhatsApp video, because WhatsApp video is very easy if they have WhatsApp. But also keep in mind, it's very interesting. I have one case, right, of a senior who has WhatsApp on his phone, but you know, he doesn't text. He doesn't know how to text. So you really have to really move your head around kind of thing, because you have so many weird things that, I mean, for me, you have to deal with, and maybe you didn't think about it, but yeah, you know, it's like, woo, okay, now I got to settle this, you know? So I think you need to be really mindful of this, because not everybody is on the same wavelength, you know. So we've got to be patient. I think patience is very important. So even one of our volunteers has come forward and said, hey, we want to do tutorials with these seniors. Tell them how to use WhatsApp, if they have that app on their phones, how to go step by step. And I'm grateful for this, because I think this digital divide, if you don't solve it or get them at least to a certain level, if we go to phase 2, or phase 1, or worse, CB, which I don't think will happen, I think more likely phase 1, we will have other issues. So yeah, I think it's good that we bring them to another level. Maybe we can't get them so advanced yet, maybe we slowly bring them up. And I think that's really important in this time.
Yeah, thanks, Eleanor. Just to check with you, have you seen a double whammy in terms of the divide, digital divide and literacy divide, whereby, you know, they cannot even type in the you know, text on WhatsApp because they don't know how to read and write. Have you seen that, Eleanor? I
haven't seen the literacy issue, but I've seen the digital divide more so. Not so much. I haven't encountered the literacy issue. I'm sure Jin Kiat or Karen could possibly highlight on that. But this digital divide is really tough. I mean, you can't say to them, hey, you go down to YouTube and watch all the videos and then you can get active. But it's really tough, because it's like, hello, maybe they don't have a phone. Maybe like they didn't top up their phone, because, you know, if you think about it, YouTube, all the Zoom stuff, the data goes really fast. And if they've got like how many dollars and all that, you know, how, you know, it's like they're constantly doing it, and sometimes they forget. So you got to really be mindful of this. And I'm really grateful also that some telecoms have come up with some great plans and really affordable plans. But I'm looking at things like, how can we possibly get some fundraising done to maybe help those who really cannot afford to top up their cards? Maybe we can help top it up for them, and then they can continue with these connections, because connections are so crucial during this time. Or else, you know, hopefully nothing happens to them and all that love. But really, connections are so important, and the community needs to support this.
Yeah. So I'd like to touch on one of the point that Eleanor mentioned, because I guess what we've seen in the youth sector is that when they do not have, they come from low-income family, there is a form of grant whereby they can go and get a computer and even get Wi-Fi at home. You know, they can tap on such a grant. What about that? Is there such a grant that exists for seniors? Yeah. Because, yeah, I guess a lot of them will need. Maybe Karen would like to share.
Okay. So there are schemes run by IMDA 2 ways. One is they provide assistance with the phone. Second is assistance with the data plan. So like what Eleanor has mentioned, the data plan ran out. So during this period, we have several requests from our seniors because they don't know where can they go to renew the plans, because the IMDA offices are closed and they only know how to get there. I mean, because most of them have literacy issues. So they can either call, but because the call is also like you're in the waiting list, for the operator to pick up, many of them also get frustrated. Out of frustration, they come downstairs. We try to help them as much as possible. That was during, they technically should not be coming down, but because of emergency, we are allowed to see them. Okay, but once we reopen, they cannot come down. They have to be scheduled for meetings, scheduled for sessions, then they can come down. So there's different restriction. So to answer your question, yes, there are plans. And with IMDA, the recent, or rather the 2 weeks old initiative is the second time IMDA is coming out, this time more so for the seniors and a more concerted effort with supporting, with the training support for seniors from rental units. So this time round, the criteria has to be seniors on ComCare or rental blocks. Then we'll submit the database, and then from there we will be able to sort out everything. Rather, we have to give it to them, and then they will look at coming down, supplying the phones down to the centers. So there's different ways of doing it. On top of that, IMDA will be sending down digital ambassador staff to our centers once a week. In addition, they are also going to different hotspots where the seniors can ask, but also this means that the seniors are able to freely walk around. So there are different initiatives. The thing is, application usually has to be more simplified for them. So that's something that we are doing on the SAC side. We're also checking whether IMDA is allowing us to apply for those not based from our other programs, not just for the SAC seniors. So I think IMDA is trying its very best to assess the situation and then work out a plan, because they already work with 4 telcos, and that's really very good. Each phone is heavily subsidized. The senior only has to pay the lowest amount is $20 for a smartphone, to a range of it, depending what functionality they want to buy.
Sure.
Comes with a 1-year data plan.
How do you all train the seniors, particularly the pioneer generation, to be digital literate in this period whereby social contact has to be minimized? So how do you all train the seniors?
Okay, 2 ways. Because as long as they are our center-based seniors, they can come down. Previously, in the first month, 2nd of June onwards, we had to abide with only 5 seniors per session. With in between the sessions, we have to do thorough disinfection. So that happened, and then now it's 1 senior per square meter. Okay, so we're allowed to expand. Although we have been watching the situation, we didn't expand so fast to allow them back in. So we were moderating our situation, and we have kept it at 5 seniors per session. But in weeks to come, we'll be expanding, allowing more to come in. Okay, so that answers the question for the seniors. So technically they are allowed, as long as they do not queue up outside, they have pre-arranged schedule, and then they come in. Now for the home-based seniors, because we are part of the AIC phone deployment program, so with that, we have the mandate to go in to the homes, because this is considered a necessary and needed item for us to train them and to roll it out with them.
Sure, okay. And so, yeah.
Would you like to,
yes, please.
I think till now we have been touching mainly on the low-income seniors, probably living rental unit. But on for I was sharing that we have another counseling program which don't really just cater to the low income, probably the 3-room. That was another big challenge. We can call them another subgroup, but that is a group whereby they got no center to go to because they're not registered. Because just one of the question was that technically everyone should be covered. That is for the low income, and some of these senior might not have, I mean, the income might not be low, but they do have emotional needs and other psychological needs, and they may not be in exact good condition relationship with their children. So that's one big cluster. And the thing is that even if you give them a phone, they can't use it at home, because when they use it at home, their children is here, and who are you complaining to? That sort of stuff. So that one will be another set of challenge altogether. Yeah, but that's something which I think, like what I said, this COVID actually exposed a lot of weaknesses, and there are a lot of things which we can work on to overcome these weaknesses. But this is definitely one of the things. And then just to answer the question ahead about literacy, definitely senior have literacy issue. That's why speaking is so much more easier. They may not be able to key, may not be able to write, but at least they can talk. So in other words, we might have to, for new technology, we should not be looking at pressing some button to activate YouTube. It might be spoken, like the smart TV. I call and then the guy comes in. Those things, I don't really see that at the moment. So a lot of scope for new such product development. Yeah, and it can be cross. Yeah, I mean, nowadays with Google, you can actually have easily translate to many language very easily. So those are things which I think we need to look at as well. Yeah. Thank you.
Thanks, Jin Kiat. And I think all your sharings are very insightful. And I think now audience wants to know also, like, how can they play a part in the effort to support the seniors? So perhaps you could share like some commendable stories that other volunteers are working on to support the seniors, and then also share how can the community, the individuals or corporate, come forward to better support your effort to serve the underserved seniors, or to serve the seniors that you're already serving. Yeah.
Maybe I can take up the question.
Yeah, Jin Kiat,
We
please.
got an offer by a tech company. They have, so it's an international company, but they have Mandarin speaker, and they offer to train not our actual senior, but our senior volunteers, let's say to use Zoom session and stuff like that. Some of these sessions, even WhatsApp, they got a lot more feature and new feature keep on adding in, and someone need to train them so that they can be, as a tool, can be effective in engaging other seniors. That's one big area. If we are savvy, tech savvy, you can help us with that. And the other group, like what I said, we need to go and touch base with them. We cannot go to their home, but at least we can go to the door. And then how to overcome the language we've thought of is like the senior, rather the more younger adult can go and then guided by phone with some senior volunteer, physically not there, but cyberly or on the phone, then can speak to the other person, something along this line. So we will definitely need, if you want to do go to the physical place, definitely cannot have engaging volunteers who are 60 and above, because that's another restriction that we have. So younger adults, we will welcome. Yeah, so these are two big areas that we will need. Thank you.
That's good to know. And Eleanor, you would like to share, or Karen?
Yeah, so basically we've had over 170 volunteers. I mean, it's been really quite amazing. We've had volunteers who basically want to do this tutorials with their buddies. So we're looking at pulling this together. We're trying to look at Zoom some sessions for those who haven't really not met each other yet. Some of the volunteers, actually some of them met against my better judgment. I told them, but please be cautious. But it's really quite amazing because they've been some of them have been extremely protective of their buddies. I've had some amazing stories that have come out in such positivity. There's a gentleman who basically wasn't very good at 3 months ago, wasn't very good at talking to others. He has 3 volunteers with him, assigned to him, and he is having a time of his life. Okay, so it's really quite amazing. There's a senior who basically cries in the morning. He has dementia. We have 2 buddies on him, and basically he's enjoying the calls. They can range all the way up to 2 hours each call, once a week. And one of the buddies, and I must share with you on this. One of the buddies is actually a daughter of someone who referred the father to us. So when I was talking to her, and it was just really coincidental that the senior with a dementia case, basically the volunteer had to drop off. And it was just really coincident. Then I said to her, hey, would you be open to maybe paying it forward? And she said, okay. And then it was really weird when I was starting to talk about the case. Yeah. It was weird. She has so much in common with him. Used to be a teacher, wanted to do art, And they have that commonality to go forth and conquer. So I thought that was really, really amazing. So I think it's what's really important is some of these guys have more than one volunteer. So what the community and even corporates can really play a part in is supporting, especially ground-up initiatives. I mean, BWs as also, but I'm a ground-up initiative trying to do some good because I care about the community. And I think corporates should really look at those, because we're doing some really amazing work, but we need help. So come on board and look at that. But I think it's so important. Two other points that I actually want to make. We need to care about communities. If we don't care about our communities, I think it says a lot about who we are. Neighbors caring about neighbors. I've got a neighbor who recommended their neighbor, can you imagine? And she called me, she said, oh my goodness, I want to recommend my neighbor to this. I'm going to talk to him about it. So it's a neighbor who's caring about another neighbor. Can you imagine? It's like, I'm really heartened by all this. And I think it's really important that we need to care. We should stop being so selfish and look at and care about each other living nearby, and really pick up the phone and say, hey, how are you doing? We just want to check in on you, you know. So if anyone wants to call me, please call me, okay? So yeah, I mean, I think this is really, really important that we need to start to care. And when we care and we start from the heart, I think that's really, really important, and that we can do it. And so even helping, so what the community can do is help volunteer, Jin Kiat, Karen, even my project, look at even stuff that are gaps in the community and maybe small little things that they can do. So just being kind, I think that's really important to be.
Sure, thanks Eleanor. And Karen, what are the needs that, what are the areas that the community can support LB?
Sorry, I forgot to mute the mic. I forgot to unmute the mic. Okay, the areas that LB needs definitely has for all charities is in terms of resources, looking at manpower and also looking at the funding. Now, two ways to look at it. Manpower is also to supplement where we need it most, especially if, let's say, we're working with the senior on the digital, the ways to help them overcome their fear of technology is to make sure that we are able to train them repeatedly on very basic function. So maybe I share with you, IMDA's plan has 3 tiers. We did inform IMDA that, and they totally agree, that we don't think our seniors are able to progress beyond, not many of our seniors can progress beyond tier 1, which is just pure communication, meaning able to switch on the phone, charge the phone, make a call, and very most use WhatsApp. We are very thankful. So if let's say, and do that part means that technically every day or every other day, we have to do the drills with them. So it can take 5 days to almost 1 week, the same thing. So it's like teaching a child how to do things over and over and over again. So we will need volunteers for that. For that, we are very short-handed. So for us, we are not asking very much. We're asking for volunteers who are patient. Because repetition, very repetitive work, which most, so imagine if let's say, because I have 4 kids of my own. So if let's say my kid asks me to repeat myself, the second time I'll be like, huh? So imagine the seniors will be asking this, asking our staff and asking the volunteers the same question every day for almost 10 days. So that is it's not that they have dementia, it's that they really forgot how to do things. And then that's what we need most in terms of volunteering. Patient volunteers who can help us consistently train them so that they get it. And get it, practiced it, and put it as part of their DNA. So once a senior has it as part of DNA, like brushing the teeth, you know, buying food from a certain store, then we are comfortable with them on their own. Before that, I don't think we are able to let them go on. I mean, basically, I don't think they'll be very confident of using the smartphone. And I hear quite a bit on the cases for dementia. So maybe I just share from the perspective of seniors with dementia, but happen to be living on their own without a flatmate in the rental blocks. For those cases, we usually, because we also have the cluster support team, for those cases, we are very concerned. So many of times we try to refer them to a residential placement. Because first of all, we don't know if they will be putting themselves at risk or forget to turn off something and then cause issues in the block. So for example, we have senior group homes whereby we have like residential units in the HDB rental blocks. And they're not supposed to cook. They only have induction cooker. Already we had a small little fire because our senior wanted to cook chicken nuggets. So we're trying to figure out, if you don't have a flame, you cook chicken nuggets, how do your place catch fire? Because the fire brigade had to come. So yeah, so these are things whereby they will put themselves at risk to themselves as well as to the whole block. Because of that, we will try our very best to persuade them to move out of the rental to a nursing facility where someone can care for them. Because many of the seniors, to be fair, all of us have our own pride. We all want to be independent. But there comes a point whereby we are no longer functioning at almost 90% or 100% of our capacity. And it's very dangerous for the rest in the community. Yeah.
Sure. Thanks, Karen. And I guess you have mentioned about the volunteers need. Potentially there could be funders here. I'm just wondering whether you want to take like half a minute to 1 minute just to share if what kind of funding needs do your grassroots organization or your social service agency needs. And yeah.
Hey, Pauline, sorry, can I just add something in the
yes, sure.
on this? Because I think it's really important to take note, right? Because some of the seniors that we deal with, we don't even know whether they have dementia. It seems that they may, but if they're not diagnosed, we're just not even sure. So there may be gaps in that too. One of the big things that I think that it's really important to take note, and something that I've learned during this whole time, in the seniors that we have served, okay, it's really some of the saddest cases of fragmented families. Like the children don't even talk to their parents anymore. I think we really need to look at these family structures and really ask ourselves and really look at ourselves in the mirror. Is this really something that we want to move forward in the future? Because in the end of the day, it's not really good to do this to our parents, no matter what they've done to us, honestly. And I think we really need to really examine this, because it's very, very sad. I mean, I can tell you, I've had a number of cases on our side. Families are so fragmented, or they don't talk to the children, and they're all alone, and it's really very, very sad. And these seniors could be us. So it's a real big issue. We really need to address this, not just the digital divide. I think we need to look at the family structures. And really, is this what we should be doing to our parents? Because guess what? It can be done to us also, okay? So honestly, whether we have 5, 10 children or whatever it is, it can also be done to us. So I want to preface this because I think it's really, really an urgent issue.
Yeah, I think you have brought up this very urgent issue, but it does require a lot of effort to change that kind of structure. Yeah. Perhaps Jin Kiat, would you like to share, like, just take a half a minute to 1 minute, the funding needs?
Yeah, I think funder, we are definitely welcome. Ourselves and LB, we are under the matching grant by government. Every dollar that the donor donate, we actually get another dollar for matching grants. So the money is needed not just for buying of digital equipment, but we also should be deploying senior if the situation allow, pay them. Don't get them volunteer, because you also need them. Sadly enough, I think quite a lot of seniors actually lost their job, because now including healthcare cleaners have been doing healthcare. I mean, cleaners have been in the healthcare sector for their whole life, are now told that after 60 they need to go because they are at risk of the infection. So it's a double whammy, because of the age, and now because of this disease. So the funding would be very essential for us, so that we can even employ this senior. So that's my appeal. Yeah.
Sure, thanks. And Eleanor, for your grassroots organization?
So my ground up, I mean, if you could show the poster, that's actually, I'm looking for seniors to refer, or seniors or family members want to refer their seniors to us. We're happy to help. Any language, any dialect, including Punjabi. We can help. Okay, and I'm also happy to take volunteers in. I've opened up the volunteer sheet. So basically, volunteers can come on. We're looking at those with dialects at this point. But look, if you just can speak English, I'm happy to have you on board. Basically, we have volunteers from all the way from 16 all the way to 70. We have seniors helping out seniors, which is really quite amazing. So yeah, happy to have anybody if anybody wants to throw money on my side, I'm happy to take also lah.
But I mean, if what kind of funding would you need? I mean, for
No. I mean, I would love to see some of these top-ups of these. So that's actually the funding that I would love somebody to throw at. Maybe to see if we could get some of these top-ups with the seniors on their cards to get paid, so that they can continue these calls. Just in case that if we go back to phase one, they'll still have something, an alternative to fall back on. So they're not really, oh my God, I'm like all alone and with the four walls again, you know?
Yeah.
So I think I've been looking at that. I'm exploring stuff. Carol can you know, we're looking at like Casey, maybe the Oscar fund, I don't know. So yeah, so anyone who wants to, or corporates who want to help on this would be great, because I think there's some seniors that we have really could use some help on this.
Sure. And Karen, would you want to share?
Yeah. So for LB side, what we need are the support, the financial support coming in terms of the kit that is going to the seniors who are still staying at home. Okay, as I mentioned, we have center-based seniors, but not all can go back at one go. So imagine our Bandemia SAC has 550 seniors across the 3 blocks itself. We cannot absorb all at one go because of space limitation, because of safe distancing measures. So with that means that technically we're putting them on rotation. With rotation means that while they may well come down to the center perhaps once every week, the other balance once every week, meaning roughly I'm looking at about 100 to 200 coming down per week. The other 300 will have to rotate out, which means that technically they are at home and they're doing nothing much. Because their life is to go downstairs to sit at a coffee shop, watch people go by. So we actually are coming up, we actually have started rolling out all the care kits. The care kits may not just be your standard mask and other things for the essential needs, but also the care kit is self-care, meaning that this is also like your mental care. Your activity sets could be gardening, it could be things that they liked. Because on LB side, we are able, we actually, during the COVID CB period, we, for the first time in our long history, we did a one-to-one calling of seniors. And because we also managed to, during the one-to-one call with seniors, so many rounds, at least twice a week, we're able to do the profiling of everybody's passions, everybody's needs. So we're able to identify what each senior really needs and really wants and really likes to do. Because last time, whenever we give things, right, is when sponsor comes, oh, here comes the goodie bag. Then we just tell a sponsor, yeah, give me, Bandemia needs 550. Okay, all our centers need 2,000 plus. Everything is standard package. But now the activities that are to be done at home, we will ask them for customization. Okay, for example, so maybe I have 2,500 seniors, maybe 500 only like art and craft, and then I want more, and maybe can do collage work, that sort of things. So these are things that we will then customize, or rather we will then give out according to everybody's needs. So during this period, as I always mentioned, there's always opportunity in crisis. So we actually consolidated all the profiling for everybody. The second one would be for the befriending side, is also another big group. So we're able for befriending, and all the other teams are able to have already done profiling for years. So because of this thing, we are able to identify not just what they need, what are their talents, what are their skills. Because with this, during this period, even our volunteer management team able to come up with this thing called the online singing competition, more for the senior, more for the volunteers, and we're expanding it to also our volunteers, and now we're expanding to our seniors. So all this various modality is according to the passion and the skills of the seniors. So we hope to get funding to provide more of this individualized or customized care pact to keep them healthy and emotionally and mentally engaged during the period whereby they cannot come down to the center.
Sure. Thanks, Karen. And I'm aware that we have overrun our time. So just any last insight that you all want to share? If not, I'll wrap up the session. So that's good. Okay, now we have come to the end of the session. Thank you once again, Eleanor, Jin Kiat, and Karen for taking your valuable time to share with us your insight on this topic. For the audience who are interested to support their work on senior, you can indicate it in the feedback form at the end of the session, and we will pass your contacts over to them, and we'll pass over to the NUS team for the closing.
Thank you so much, speakers, for your sharing, and thank you, Pauline, for moderating. I'm so sorry, but we will be overrunning slightly, so if it's okay, would the speakers be okay for staying on for just another 15 more minutes? Thank you so much. Okay, so our speakers have shared about the opportunities that the audience can volunteer in, especially in phase 2, where younger adults are encouraged to step up to help and protect our senior volunteers on the ground and with the technological side. As such, these are some of the opportunities that our speakers' organizations that are interested in volunteering in. But also, are there any questions on the ground in the viewers and the audience? If so, would you like to ask your questions in the chat? And you can type them, yeah.
Okay. If there are any questions, maybe we can proceed with the volunteer opportunities.
Yeah. So our speakers have shared some of the volunteer opportunities during the panel session just now. And you may take a screenshot of these if you are interested in any of these. So speakers, if you don't mind me bringing this up on you, if you could share 2 sentences for potential volunteers tuning into this webinar right now, what would you say about these volunteer opportunities? Perhaps we could start with Karen for Alliance Befrienders.
So the volunteering opportunities are with a wide spectrum. We can do it virtual befriending, that's one. The other way is to do design and the development of applications. That's something that we also need. The third one would be in terms of the training of the seniors on a one-to-one basis.
Okay, thank you so much. What about Eleanor for FESA, Makan with Seniors and Project Buddy?
You're talking about 2 words, right?
Two sentences.
Okay,
2 sentences.
okay, I was going to say, I'm going to cut it short. 2 sentences. Okay, basically, my stuff creates empathy and understanding. So join and because basically, if I could say one last thing, this is your future. If you care about your future, see how you can understand aging and seniors better.
Thanks,
Thank
Eleanor.
you so much. What about Jin Kiat?
Like to appeal to people who are other than what they showed here, the facilitator, as well as the para-counselors for younger volunteers, those who are tech savvy. We have this big program in Upper Boon Keng, and we need people to help installing those devices, like what I mentioned, on body, like all your trackers and in-home, your motion detector, everything. So we will greatly like to have volunteers coming in. It's not going to be all over the place. It's just going to be Upper Boon Keng. And we are targeting about 100 such seniors of different type of capability. I mean, in terms of weaknesses, vulnerability. Yeah. So we'd like to appeal, if you're interested, can come, and you're living around Eastern side, Boon Keng, that would be great. Yeah. Thank you.
Thank you so much.
you?
Oh, sorry. Yes, please.
If you don't mind, for particularly corporates or anybody else, I'm looking for when things open up and events are opening up and all that, I'm looking for a place for Makan with Seniors to hold my event every other month. So I'm looking for space, free space, hopefully, because I cannot afford to pay anything. So if there's opportunities like that, please let me know. Yes.
Okay, thank you once again, speakers. And we will be leaving their contact details later on in our wrap-up package. So thank you once again, Eleanor, Jin Kiat, and Karen. And thank you once again, Pauline, for your moderation. I'm sure we've all learned very much on how we can do our part to better support our vulnerable seniors in coping with the new normal and helping them age gracefully in this post-COVID world. But today, our takeaways from this webinar has only kick-started our journey to do so. What matters is what we do after today's webinar.
So if you have any further questions about anything that's been shared today, or if you would like to volunteer and join our speakers in their movements to take care of the vulnerable seniors in our society, you'll find their contact details on this slide here. You may take a screenshot of this if you like. Stay tuned for a post-Connex package which we will send out to you within the next week. It will include publicity materials for Ageless Online, Ojoy Care Services, and Lions Befrienders for their volunteer recruitment drive, as well as a summary of today's sharing. We hope that this will help bridge the gap between you, our audience, as well as the VWOs and non-profit organizations who constantly need the support for the remarkable work that they've been doing. Last but not least, on the behalf of the team at Suristic and NUS, I would like to thank you all for taking time off your day to tune in to our Social Connex webinar, and for being active citizens who care about social issues that we face in Singapore. As they say, many small steps by a community is what will bring about big things in our society. So thank you very much for taking a small step in helping our vulnerable seniors move forward from COVID-19. Now, before you leave the meeting, sorry?
No, thank you, everyone.
Yeah, thank you. So
Yes. Thanks. So before you leave the meeting, could we ask that you fill in our feedback form very, very quickly by scanning the QR code on the screen or entering the link tinyurl.com/COVID-19 seniors. My colleague Min has been sending the link in the Zoom chat quite frequently throughout the entire call. So your feedback would go a very long way in allowing us to improve future renditions of the Social Connex series. And we will appreciate any input very, very much. With that, thank you once again, everybody, and have a very good night. Thank you.
Thank you, everyone.
Thank you.
much.
Thank you.
Thank you.
Bye.
Good night.
Good night.
Pauline, I can leave.
Yes, we all can all leave. Thank you.
Thank you so much.
Thank you very much.
Thank you.
Good night.
All
Bye.
everybody's. It was okay.
Thank
It
you.
was good. It was good. Thank you so much.
Thank
Thank
you.
you. Thank you.
Bye. Bye.
For the rest of you, if you need the link for while we'll be here until most of you leave the Zoom chat, so don't worry about it. Yeah, the QR code will still be there for you to scan. Thank you.